And I want you to meet Dr. Carol Ash, who's the medical director of the sleep program at Meridian Neuroscience. And Dr. Ash is a board-certified internist. She's specialized, too, in pulmonary and critical care. But sleep medicine is a fascinating field, and a field that a lot of people did not take seriously enough until now. Yeah. And explain a little bit what is involved in sleep medicine.
Well, Joan, most people really don't even understand the fundamentals of sleep. And there's two very basic principles. You have to remember amount and timing. You need the right amount of sleep and you need the right timing of sleep. On average, it's 8 hours, the range being 7 to 9 hours that you need in a 24-hour period. And you need to go to bed at the same time and get up the same time every morning. And the reason why, Joan, when you open your eyes in the morning and expose yourself to light, there's actually a clock in your brain that light then sets, and that clock maintains patterns of wake and sleep, but also is linked to and regulates all the physiologic processes in your body.
But you say we need, what, 7 hours, 6 hours, 8 hours?
The range for people is 7 to 9 hours, but think of it like diet. You know, sleep is a basic necessity, no different than water, food, or air. And we all know that we need a certain amount of calories in a day. You could eat more or you could eat less. You know, you could eat 400 calories a day. You could force yourself to do that. We all know we will pay a consequence to that. There's a physiologic impact.
But you know what? I guarantee you that if we asked everyone in this room, women and men, how much sleep they got.
Not enough.
I bet almost no one got 8 hours, 7 hours. I think we get literally maybe 5 hours.
It's a real epidemic. And you know,
what do you do though?
Well, the first thing is just trying to educate the public on the importance of sleep and the impact, how it's really having an impact on your health. So, you know, if you went back to George Washington's time, George Washington, by the time he was the president, had wooden teeth. I guarantee you, if we found out Obama had wooden teeth, or Mitt Romney had wooden teeth, you'd say, well, they can't even manage their teeth. How can they manage the country? So, you know, we've moved to a point in time where we understand the science of sleep and the importance of some of these things for our health. So we have to suggest to people that you really do need to stop sacrificing your sleep.
But how do people get the kind of sleep you say they need?
Well, first off, you want to make sure that you can't just transition into sleep. Believe it or not, most of us are so tired that we hit the pillow and we're lapsing right into sleep. The thing is, the brain needs an hour to transition into sleep, so you want to create a relaxing bedtime routine. You know, whatever it is you do, you do it every night and be consistent about it. You want to create a very calm, quiet, dark place
before you fall asleep.
Before you fall asleep. And believe it or not, the actual best temperature for sleep is actually quite cool. It's 65 degrees. Now, the actual set point for each individual is unique to you, but it's cooler than most people believe. And you fall asleep on a temperature drop and you wake up as the temperature elevates. So quiet, dark, and cool, and get all the electronics and all the distractors out of the bedroom. And you want to make sure, if you do just one thing, pick the same wake-up time every single day.
So at what point does someone say, I need to go to a sleep doctor?
Well, the truth of the matter is, if you really do follow all those rules and you stuck to it for a month, you would jump out of bed in the morning. You wouldn't even need an alarm clock. You would wake up and you would feel awake all day long, and you'd be feeling quite happy. If you really follow those rules, and if you really do it, it's no different than saying, I really exercised, I really dieted, and I'm still struggling. So after a month, you would say, I really need to reach out to somebody and get some expert help on doing this.
And what is help when it comes to sleep?
Well, sleep, it's a very, very complex process. You have your own set of neural circuits and neural chemicals. So most people go to the doctor and they just say, I can't sleep at night. And you get a sedative to help you sleep. That would be no different than a doctor giving you a pain medication for pain. Now, that may be appropriate, but wouldn't it be better if they took the nail out of your knee and not give you pain medication? So the doctor really has to ask you questions. Why aren't you sleeping at night? And they have to spend time with you. And you know, more and more doctors are realizing, if we're really going to do the right thing for patients, we have to take that time to figure out, what do we need to do for you to get to the problem, the root cause.
So what you first should do is pay attention to what the doctor is talking about. Dr. Carol Ash, who is medical director of the sleep program at Meridian Neuroscience. We know, we've heard about it so much now. Sleep is really essential for your health.
It really is.
So dark room, don't just drop into bed and fall. I can't tell how many people I know who live on Ambien.
I know.
Is that habit forming?
Well, no, it's not habit forming, and it's really okay. But again, if in a combination of therapies, because you want to know what is the reason that this person is not sleeping, and try to resolve that problem. And some people, again, if you went in and you had a ruptured tendon, you need pain medications, but you need physical therapy too. So there's a combination of things that we may need to do. And some people need a sleep study. I'll tell people a sleep study is like an MRI. An MRI helps a doctor look into your body.
See what you've got.
A sleep study looks into sleep.
And can you correct people's problems usually?
Yeah, absolutely. You know, when you really, really work through the problem and identify what is wrong, there are so many treatments that are available now. And, you know, at Meridian Health, I mean, it's a great place to be practicing as a physician because we really do have the resources to make a difference for people, and it's a good thing.
What role does food play? If you eat dinner late, is that going to have an impact?
Yeah, you know, it really does, because for some people it can cause problems with acid reflux. But here's the problem. If you are not, in terms of your weight in food, because I know it's a big issue for a lot of people, their weight, if you're not getting the right amount of sleep, hormones that are tied to your metabolism are disrupted when you're not getting enough sleep. It will actually cause you to gain weight. So not getting enough sleep causes diabetes, obesity, cardiovascular disease. You're prone to strokes and heart attacks. It's such a stressful thing on your body not to get the right amount of sleep. It releases all types of inflammatory substances, and it will actually age you. You know, we talk about the antioxidants and how important it is to eat foods that counteract those antioxidants. Sleep is one very cheap way that we can all do that.
So if you say you can't sleep more than 5-6 hours at night, if you take a nap, is that going to add to it?
Well, the thing is, if you're not getting that full amount of sleep at night, you have to ask why. I'll say to people, we're not cats. We're not designed to sleep like cats and take naps. We're designed to have a block of sleep at night. But for some people, there are reasons why it's impossible to get that full night of sleep. Then a 20-minute nap is okay. But Joan, the interesting thing about naps is if you nap longer than 40 minutes, you'll go into deeper stages of sleep. And when you arouse, have you ever noticed sometimes when you oversleep, you're very groggy?
Right, you don't feel well.
So keep it to 20 minutes. That's all you need for a refreshing nap.
Really?
Yes.
So you can go close your eyes for 20 minutes, you're up and you're ready to roll.
Yeah, if you're that tired, you will. And, you know, people, what people don't realize, usually at the midday, they start feeling a little sleepy. That's a signal to you that you're really not getting the right amount of sleep. Because you wouldn't be, you know, after lunch, you'd be stuffed. If you were in a warm room, you'd be hot.
Right.
If you were listening to a boring lecture, you'd be bored. Those things are unmaskers. They unmask the natural sleep debt. So
quiet, cool, dark.
You got it.
And if it doesn't work, go see the good doctor. Dr. Carol Ash, medical director of the sleep program at Meridian Neuroscience. And we always want to thank Meridian for having the best doctors. I'm Joan Hamburg. I want to introduce you to practically a neighbor, Dr. Carmela Rocchetti, who's a primary care physician, and she is part of the faculty of Robert Wood Johnson Medical School and Hospital, and she's with Jersey Shore Hospital as part of a group. So, you know, I was talking to Dr. Rocchetti. How many times do people say to us, it's all about prevention? Well, the truth is, what's that mean? You know, it's like saying network. Network with whom? The neighbor I've lived next to for 30 years? What is prevention? When you tell your patients it's about preventative medicine, what are you expecting from them?
So that's a great question. Preventative medicine really means a few different things. One, it means making sure when you go to your doctor, you're not just going there to follow up on your high blood pressure or to get your cholesterol checked or to follow up on chronic conditions that you know you have and get refills of your medication. It's important to do that, but when you're seeing your doctor, you want to make sure that you're either going in for a focused preventative physical or your doctor is doing it at the follow-up visits. And what does a preventative physical mean? That means that you're reviewing whether or not you're up to date with immunizations, specific screening tests related to your age and gender. So are you up to date with your colonoscopy, your mammogram? Have you had the appropriate diabetes screen done? It also means screening you for more subtle things. So is your doctor asking you questions to detect underlying anxiety or depression or a sleep problem or other more subtle issues?
But, you know, today people would love to have better relationships with their doctors, but it's a different time. And doctors are so busy. I have one friend who said the only communication she has is by email with her physician. So how do you as a physician really establish relationships with patients? Because insurance occupies much too much time of a physician's practice.
I think first and foremost you have to understand your physician's way of practicing and the way their practice is set up. So important questions to ask a new physician is, what's going to happen to me when I get admitted to the hospital? Are you going to be my physician? Will one of your partners be my physician? Or will the hospitalist service take care of me? All of those options are okay, and none is better than the other if they're done correctly. But as a patient, you need to know what will happen to you if you do, unfortunately, get admitted. I also think that both patients and physicians need to have an open and honest relationship, which means if the physician is presenting a plan to you that you think is bogus and there's no way you're going to take that medicine, or there's no way you're going to be able to sustain the diet recommendations that you're going to have, that they're asking you to do, you need to be honest with them and tell them, I think that's wrong, or that's wrong for me, I'm not going to be able to do that. So the physician and the patient need to work together to come up with a plan that works for them.
What has the internet done to your practice? We were laughing.
Tortured me.
You know, I asked Dr. Rocchetti. Her husband's not a doctor. You know, she said, well, he thinks he knows more than me. But when all of us, you know, we go online, we find out much too much. So how do you deal with that?
I try, first of all, patients are not always telling their physicians, I read on whatever, or I Googled my symptoms. And if you are going to the doctor and you're worried about something that you read online, it's important to tell them what your concern is. There's a tremendous amount of knowledge on the internet, and it's a blessing, but it's very hard to individualize that information. So I would tell people to be very cautious about what they read online, and if they are concerned about something they read online, to discuss it openly.
Are we being over-tested? You know, how many times are we told, you got to have this heart test, you have to have that, and the patient might say, but there's nothing wrong, I have no family history. How much, we talked about preventative, we started. How many of these tests do we need?
Some tests are definitely more efficient and important. I think if your doctor is ordering a lot or you're on a lot of different medications, you need to ask your doctor to identify the main focus, because your health can be very overwhelming. So it's important to say to your doctor, okay, out of all the things you want me to do, what do you think is the most important? Or out of all these medications, what do you want me to to make sure that I never miss?
So question it. Don't just accept it.
Right. Question it to understand it better and to be a part of the planning process. So you're going to your doctor for advice. It's a conversation. It should be a dialogue.
What made you decide to get into medicine?
I love talking to people. I love hearing their stories. I loved helping them live a better life. Every time I see a patient, I feel like I can coach them a little bit on how to live healthier, and watch them grow and hopefully be healthy.
What about exercise?
Exercise is the key to life.
You really believe that?
I really believe that. Exercise is the key. It doesn't matter what you do. If you can walk every day, go to the gym, take classes. If you have arthritis, you might not be able to. In that case, yoga, Pilates, swimming, there's options for everyone no matter what their level is. Exercise is great for cardiovascular health. It's great for mental health. It's a form of meditation.
Okay. So lifting a glass or opening the fridge is not going to count?
No. Also, my patients always tell me, I'm always running around, I'm very active, and that's not the same. You have to put on sneakers and have a dedicated exercise regimen in order to really get the cardiovascular benefit of exercise. Parking far in the ShopRite doesn't count.
It's not going to do it? Are you sure?
It's better than nothing, but it's still not enough. You need to have a dedicated exercise time.
Like what, every day?
Every day. You should move every day. Again, no matter what your level is, not everyone can go out for a jog or walk, but whatever it is, it should be done every day.
Thank you, Doctor. Dr. Carmela Rocchetti, a primary care physician, and Dr. Rocchetti is with Jersey Shore, one of the great hospitals, all part of the Meridian group, and a part of the faculty at Robert Wood Johnson. Much success. We'll talk to you again.